With several states in the USA beginning a gradual reopening, all eyes are on the hardest hit region of New York, where deaths fell to their lowest level in almost a month this past weekend.
The overall hospitalization rate is down. The number of intubations is down. Even the number of new COVID cases is down, still not good. Still 1,000 new COVID cases yesterday, to put it in focus. That would normally be terrible news. It's only not terrible news compared to where we were. This is just terrible news. 367 deaths, which is horrific, and there is no relative context to death. Death is death. 367 people passed, 367 families.
Despite the continued tragedy of loss, mainly around New York City and its outlying suburbs, the state is considering a phased reopening that could begin as early as March 15th. Phase 1 would allow for construction and manufacturing activities to resume, particularly in parts of the state less affected by the outbreak. Phase 2 would allow for a business-by-business analysis based on how essential the business is and the risk involved to health and safety.
The pause is statewide until May 15th, right? Then you have the CDC guidance that says total hospitalization is declining for 14 days, okay? So we get to May 15th. What regions have seen a decline for 14 days? Well, we're assuming we will have seen a decline in the state for 14 days. But what regions of the state have seen a decline for 14 days? That's where you will start the conversation to get to phase 1 in that region.
In Europe, the three hardest hit countries of Italy, Spain and France are preparing to slowly loosen their restrictions further, while the UK's Prime Minister, on his first day back at work after recovering from COVID-19, indicated they'd proceed with caution.
I understand your impatience. I share your anxiety. And I know that without our private sector, without the drive and commitment of the wealth creators of this country, there will be no economy to speak of. There will be no cash to pay for our public services, no way of funding our NHS. And yes, I can see the long-term consequences of lockdown as clearly as anyone. And so, yes, I entirely share your urgency. It's the government's urgency.
Schools in China's most populous cities of Shanghai and Beijing reopened for the first time in 3 months, with temperature checks and social distancing being maintained for students and teachers alike, tempering parent concerns.
Generally, I'm happy, not worrying so much. I think the school prepared sufficiently. It had parent meetings in advance. Teachers had detailed plans in place 2 weeks ago. This is way beyond any parent's expectation, so I'm not concerned about this part.
And as these phased reopenings begin to take hold, a resurgence in any case numbers would quickly put the brakes back on and stifle any optimism of a return to at least a degree of normality in the short to medium term. Sherwin Bryce-Pease, SABC News, New York.